Welcome to How I Grew My Practice, the podcast where health professionals share the behind-the-scenes stories of how they built a thriving practice. Each episode will uncover surprising challenges, victories, and life lessons learned throughout their journeys. Let's get started.
Welcome to How I Grew My Practice, a podcast presented by Next Health. I'm your host, Alec Goldman. In this episode, we have Philip Toh, operating partner at the Smilist, a DSO based in the Northeast region. He's here to talk about how his organization is using technology to scale and grow his employer brand and DSO. Phil, welcome to the show. It's so good to see you. How are you doing?
I'm doing well. Thank you, Alec, for having me on the show.
Very fortunate from our perspective. Obviously, Smilist has been an Excel customer for quite some time. Incredibly gracious for your business and learning so much from you along the way, Phil. But for those who do not know Mr. Philip Toh, if you can give a quick introduction to who you are and kind of how you came about being a part of the founding team, the partner of the Smilist, and what.
So I'm one of the co-founders of the Smilist, and kind of fell into dentistry, I suppose, kind of after business school. So after business school, I went to work for a healthcare distributor called Henry Schein, and so that was kind of my exposure to dental. The joke was, I didn't have these career aspirations to be in, dental middle management, but that's kind of how I started my career at Henry Schein, and there I really kind of got to see, this whole segment of DSOs grow, much earlier than, now I think it's kind of very common that, people know about dental groups and how they've kind of in many ways replicated the medical side, right? But there for about 10 years, kind of got to see them grow all around the country as well as around the world. And so, after, I guess towards the end of my career there, started chatting with an old business school classmate of mine. And we said, I think there's an opportunity here in the New York metro area to start kind of our own DSO. So it was kind of like this flip from, being the seller on one side to being the customer kind of on the other. And that, was just super exciting. And I think that's something that even Schein encouraged in a lot of their employees was kind of how to be an entrepreneur. And so, in 2014, took the leap and together we bought our first practice and from the, on Long Island. And then now we've probably bought, upwards of over 70 practices. And now we have 65 locations throughout kind of New York Metro, from Philadelphia to Connecticut, actually Delaware to Connecticut.
So exciting. Can you dive a little bit more into the gap that you saw that you're, thinking about, hey, what was the gap within patient care that you thought there was an opportunity to fix, improve, and ultimately scale?
Yeah. So I think, one of our kind of thesis was really thinking about, kind of even take a step back, and you said, okay, I'm a dentist. I graduated from dental school, and then all of a sudden, I work for somebody, and then ultimately I buy a practice and I, run that practice. And we'll say that person is a bit of like a forced entrepreneur, because when you go through dental school, hey, I didn't learn about marketing, I didn't learn about HR, I didn't learn about finance, but somehow you're kind of forced to do it. And this idea of, there's an opportunity here to, kind of run, the business of dentistry better, because, anytime you kind of focus and, hey, I'm going to do this thing like really well. And so that kind of came up with the idea of how do you partner up with the dentist, let that dentist focus on the clinical side of, doing their job, what they went to dental school for, where they spend the vast majority of their day, instead of being a part-time marketer, after the day ends, after I saw my last patient. We have a team of people that focuses on marketing, on IT, on HR, on finance, and kind of do all of these things so that, it's kind of the sum is greater than the whole. And so related to that is oftentimes, if you talk to a dentist, they talk about, that patient experience is just around like clinical care. Hey, I provide really good care for, for so-and-so, my patients, as opposed to the overall patient experience. So that's where, that gap is, because now we have a team of people that think about like the rest of the experience, whether it could be, things like online scheduling, or kind of being able to make their payments, or being able to communicate with us, that's not necessarily just a traditional I showed up, at the practice. And so when we think about all of these things, then, we're able to enhance that patient experience to, like we're trying to modernize that experience, because it's not like, back in the day that, somebody makes, a restaurant reservation, they would call the restaurant. Now it's like nobody wants to call the restaurant. They're just booking it online. And I think very similar as those kind of consumer kind of habits kind of are building, and thus the expectations change, how we're applying that into dentistry and into healthcare, and what, patients expect from us. And that's part of that patient experience. I mean, even when you look at most of our reviews, it's, it's not necessarily, hey, I got the best crown ever, or I get the best, whatever, cavity filling ever. But it's about like, hey, I love, the staff was friendly. I could book my appointment online. Those things are part of that patient experience. And we're able to provide that experience because we're able to, provide something consistent, as well as freeing up the staff's time to not, be on the phone with the insurance company while the patient is, standing right there in front of you. So how do we take those things away, so that, the staff can focus on, the patient that's in the office? And so all of those things, you can do because you're, through scale, we're big. So, hey, we can do these things and take some of these functions out of the office, so that people in the office can focus on the patients that are coming in.
So the topic that we're going for is, how to use technology to scale, growing obviously the business and really an employer brand, right? Like making staff really happy to work at an organization like the Smilists. Technology is such a vast word. If you can share, and maybe it's obvious to yourself, but just if you could share, what are the key technologies that we're talking about that are enabling the Smilist to scale?
Yeah, so, building upon, what I mentioned earlier, is really, how do you make their job easier, right? So when we're talking about scaling, one of the things, knock on wood, that we're good at is when we affiliate with the practice, we're usually able to drive growth. And so a lot of times when, again, broadly speaking, that technology word is used, people think, oh, this software or this kind of program is going to try and replace me or some portion of me, as opposed to, no, that's not how we think about it. We think about it like, how do we get, the team to focus more on how to, deliver kind of more intimate and engaging care with the patients. And so, we utilize technology to, I mentioned earlier, do online kind of scheduling. That can be done, so then that, the phone doesn't ring as often. Well, the phone's not ringing, then I can pay more attention to the patients that's right in front of me. And likewise, we have technology that will do, all your benefits verification, insurance verification, for the office, so that they're not on the phone with, the insurance company. And so those types of things are, really enhancing the way, patients kind of interact with us. We also have utilized technology that, we use chatbots that can, interact with the patient, and they can do things because of the connection we have with our practice management system. They can confirm appointments, they can check on appointments, they can reschedule appointments using a chatbot. And again, that kind of takes away, perhaps a phone call or multiple phone calls that would otherwise come into the office. So we try and kind of pull these activities, out of the office, so that the people in the office can interact with patients. Which, going back to like, how does that impact kind of our growth? Well, kind of somebody that has these tools are just going to be, I'll say kind of happier employees, right? So don't meet too many people that says, hey, I love to be on hold for 30 minutes, on the phone with the insurance company, at the office. And that's kind of like my day-to-day job. I believe many people in healthcare are in healthcare because they enjoy and love that, the patient interactions. If you're kind of in a non-clinical kind of role, and also the clinical interactions that you have with patients. They love taking care of patients. And so to the extent that technology kind of allows that, makes them be able to do that better, I think that's what, is the difference for us. So many times people think, oh, technology can kind of do this one particular task, but we think about it more broadly in terms of how do you enhance kind of employee satisfaction, kind of just allowing them to do their job better. So, who doesn't want to do a good job? And that really kind of helps grow, the organization as well as the culture, within the company.
So just to kind of spell out the very detailed process, you acquire a practice. That practice is likely using different technology than what the Smilist greater organization is on. You come in and say, hey, the tools and ways at which you've been operating, we're going to be making some changes. We're going to be installing perhaps this EHR and perhaps this patient experience platform. That obviously, for somebody who's been in a role for an extremely long period of time, can be scary.
Yeah.
So can you talk about some of the challenges of just change management as it relates to technology?
Yeah, so absolutely. That's, our business model is, as I mentioned in the introduction, we've kind of partnered up with, over probably upwards, almost 80 practices. And oftentimes, the technology that they're using, or perhaps lack of technology they're using, is one of the big kind of change management kind of aspects that we work on and really focus on. And so one thing that we've found successful, and agree with you, it's completely scary and kind of intimidating for them, but we find it very, much more effective when we're able to kind of bring in staff, like our integration team are kind of very experienced. So it's not like, hey, we send in the IT team and the IT team's going to switch you from this, piece of software to the next. We have a combination as it relates to technology, an integration team as well as the IT team. The IT team can kind of manage a lot of technical aspects and really just making sure it works. But the secret sauce is really the integration team that has been there and done that. Hey, I've been in this role before. It could be an assistant role. It could be a front desk role. It could be a hygienist role. I know kind of what you're going through. Some of them have gone through kind of integrations and conversions themselves. And kind of being able to make that kind of that connection, that deeper connection, and not just saying, okay, this is better for you for X, Y, and Z reason, is like a huge kind of game changer. That because it's not just how to use kind of a piece of software, but like why it's important and why, this is better than the next thing and what it means kind of for them. And being able to translate and being able to kind of articulate it in their own kind of words and vocabulary just makes like a world of difference. It's not like, hey, we never want to, when we step away, after whatever the first week, it's like, you know what, Phil doesn't understand my business. He doesn't understand dentistry, doesn't understand how my practice works, because technology is just one of numerous things that we have to get right. And so we want, where we walk away says, hey, we get it. Doesn't mean that there aren't bumps along the way, but because we understand each other, there's more kind of leeway for that. When issues do arise, to say, okay, well, let's kind of talk through it and how are we going to problem solve and figure this out. And so we don't take that that hammer approach. We come in, say, okay, here's all the things you need, and take it, and that's it, and then we're gone. we're very kind of collaborative in the way we introduce and implement technology.
It's a really nice touch. How long does the integration team stay at each office? And, what are some of their responsibilities? I'm sure certainly shadowing and helping train on existing technologies like in X Health. But
Yeah.
what else are they responsible for to ensure an easy migration from being an independent practice to being a part of the Smilist brand?
Yeah. So, when we think of, oftentimes when we think about like a conversion, there's a specific date in mind, but, there's just as much work that takes place prior to it as well as kind of after it. So this idea of like, how do we kind of minimize surprises? So whether it be, converting practice management system or let's say kind of, onboarding them to Next Health, look, the great news is we have lots of other offices on it. And so there's a lot of, internal experts. So we start kind of reviewing and showing them, well before kind of that conversion date. Here's kind of all the tools. Here's how we use it. Here's all the different features. There's almost like an internal kind of testimonial, of sorts. And so they're able to kind of see it ahead of times, depending on the size and the number of staff. It could be whatever, a week in 4 weeks in advance, kind of leading up to it. A much more involved one would be kind of the practice management kind of software, kind of training them. They'll kind of bring laptops. We have it run in the cloud so we can remote into other locations and then basically show them like, hey, here's all the things that, not just like that are different, but here's all the things that are the same. So this feeling like, oh, it's not kind of completely changed over. And then afterwards, uh, you know, our growth model is very predicated on kind of us having kind of geographical density. So, we're not trying to be in, 20 different states and we only have like a handful in each state, whereas we have a lot in kind of very concentrated areas. So we build kind of this kind of network and community. And then so when we're training, that integration team might be there for, let's say, the first week. So as you said, kind of shadow and kind of be able to answer any questions, kind of walk through all the different scenarios, but also having that community where it says, you know what, I need help. And I feel good that, I have that relationship with Phil, with Alex, so I'm just going to call them up or Slack them, these kind of types of questions. And so because, we set up our technology where people can remote in, I could kind of jump in and kind of log into whatever your office and then be able to walk you through how to do something. And so a lot of it is just, I'll say, kind of mental, knowing that, hey, I have a safety net. So yes, all of this stuff is daunting and it's not, it's may or may not be easy, at least in their minds, but knowing that there's a safety net for them that, hey, I'm not here by myself, or, oh, on Friday Phil leaves and, then I'm by myself. Just having that, like, look, we're all a team. We're here to help each other. And that, makes a world of difference because every whatever integration is going to be a little bit different. And so, so it's important for us to be flexible in that, not have this kind of rigid kind of playbook because we've yet to find one that works 100% of the time.
That makes sense. I guess you mentioned the community word, but each of these practices obviously are not located one next to the other. Yes, they're in the same region, but how are you building a community across practices, across the teams at each of those practices?
Yeah, so a variety of different ways. One, I'll say, kind of starting with kind of virtually. I mentioned internally we use Slack, so we have a variety of kind of different Slack channels. Some that are office specific, some are region specific, some are kind of role kind of specific. So there's that interaction, and on Slack, it's more than just I'll say like business. There's lots of fun things kind of that goes on as well. So, culture is one of the key pillars in, I believe, kind of our success. So that's one. Two, there's a lot of, regional events. And so, we'll typically have regions for both, we'll have like a summer event as well as like a winter event that kind of bring people kind of together. At a social level, right? So it's not like, again, oh, I come for like a business meeting type of thing. So, like, for example, earlier this year, we had a doctor summit where we brought everybody together in Times Square. And so that people are now kind of interacting, and then they know each other. They kind of have backgrounds on each other. Um, and then obviously there's like the business side of things as well, where regional managers will kind of bring the team together. It could be various kind of regional training sessions. It could be training even, let's say I'm a new employee that's starting, and then they'll send me to location B to kind of train with that team, even though I'm going to permanently work at location A. So then I kind of create that connectivity with somebody at a nearby location. It's like, oh, I know the team because my first 2 weeks I started somewhere else and I met that team, and then I came back and then I work in this location. So you kind of do enough of that, then there's kind of connectivity across the organization. So it's not one thing, it's lots of different things, and I'm sure I'm missing some.
I'm sure, but certainly it's a huge focus for the Smilist. And I'm sure it's why the retention of your staff across the locations is just so great. Um, Obviously, the Smilist, the business model to what you said is that dentists focus on the clinical care and are going to get lots of support before, during, and after each patient appointment. It means that the technology that your organization is using specifically before, also during, and really after, is so important. Can you talk a little bit about what is the criteria that you have in your head of when selecting a vendor for something that is just so fundamentally important to your bottom line?
Yeah. So, it's crazy to say this, but it has to work. I can't tell you how many things that you look at and then it's like it doesn't work. Um, and whatever, I'll caveat that by saying it has to work for us, because we have our set of processes and our kind of culture. And so when we look at technology, it has to make sense, and where again, going back to like, it really is helping. We've tried software where, it kind of sounds good. And again, for a variety of reasons, it just doesn't work and it just makes things more kind of complicated. Talked a lot about, change management already, but, one aspect of that is like workflow. It's okay, I'm used to doing things in kind of these 10 steps. And then now there's some, small to large kind of change that I need for it. And so whenever we're evaluating technology, we keep that in mind a lot. So it's not just, hey, what are all the the features that the software can provide, as opposed to not only can it provide that, but how does that fit into how we work, and how much of a lift is that to shift that change, clinical or kind of otherwise. And oftentimes when we find that that's the case, because inevitably the features, we're only looking at technology that can really kind of benefit like the team and kind of make them be able to do their job more efficiently. It's not so much, hey, can it, does it do what it promises to do? I assume that it can, once it passes the does it work kind of criteria. But after that, it's really, how does it fit into the organization? And does that company have the resources to help make that happen? Because at the end of the day, it's kind of like, we know kind of our team and our processes really well, and then the company knows their product really well. So we need to have the appropriate level of resources to connect and say, okay, these are the things that we can do, well, kind of together, and we need kind of your help. And so we find whenever we're talking to companies, like what kind of support do they have, and training, because ultimately once you get it integrated, we're very confident that it will help the organization.
So I have to bring up the history here, but you were a longtime believer in Next Health and Alaman.
Yes.
And Next Health, I'm confident knowing Al and the team and our product and engineering folks, the tool always worked, but you were using a fraction of what it is today and really believed in the business early on. So I wanted to get your perspective of like, what was it early on that you saw in Next Health to have joined and committed your organization to our platform and ultimately have seen it through to what it is today?
Yeah. It's I think it was something you said earlier. It's a people business. And so, when I got a chance to meet Alameen, it was just, hey, we connected, um, and kind of really like the vision that, he had painted. And, the thing with visions is, you're not there yet, but really like the direction in which kind of Next Health was moving. And even, today it's a very kind of customer oriented kind of organization that will say, it's okay to tell me bad news. It's okay that you to tell me, hey, these are the things that you're not happy about, because they'll evolve it. And so our prior kind of vendor that we dealt with, the product is very stagnant. There was nobody to talk to, and you just didn't get this feeling like, okay, I'm going to be here a year from now and it will still be the same thing. Whereas with Al, kind of chatting with him, he was always kind of soliciting, oh, what do you think about this? What do you think we should build next? And, didn't always listen to what I had to say, but there was that curiosity and kind of taking that kind of customer feedback to continue to evolve the product and the company. And so for us, like I was saying, like if we stayed with our other company, it would have been the same a year later. But with Next Health, it was different from, day one to day 365. It was different. And then, the next kind of year was different. And that kind of continued evolution, just as, we like to grow and we do things differently. Like earlier, I described our integration process. It did not work like that. At the beginning, we had a lot of bumps and we took a lot of feedback. So philosophically, I felt like we were very kind of like-minded organizations, and I thought that we could create a lot together as a result.
And again, I could, thank you 10 times over. But the business I know is extremely thankful for your trust early on, because jumping into a platform that is early days relative to competition that's out there has way more features. But again, if the curiosity, if the vision, if the alignment is not there, then um, it's hard to make that decision. So, at least from our
Yeah.
perspective, certainly extremely excited about the partnership. What are additional technology changes that you're thinking about implementing for the Smilist, over the next year?
So one thing that we've been thinking a lot about is just data, and I'm not sure if maybe this is specific to us. I don't think so, but our ability to continue to leverage technology and all that it has to offer is heavily dependent on the information that we have. The good news is we have a lot of information about our patients, all the times that they've come in, different types of procedures, kind of, employers, insurance, all of this. I think that we have really kind of scratched the surface on utilizing that data to provide a very kind of customized, patient experience. And that could be in terms of, patient education. It could be just kind of overall interactions that doesn't feel like, oh, I'm getting a templated email that's kind of wishing me happy birthday on my birthday, and I think there's just a lot that can be done around that. Um, and I think there's a lot of flowing effects, and not just in terms of like the actual just like patient communication. I know one of the things I was talking to Al about is like, how do we like Uberize that dental, visit experience where, okay, you're going to book your appointment online. You're going to know how much, the visit's going to cost. You're going to have all your payment details. You're going to come in, you're going to go, get your treatment, and then you're just going to walk out, just like you walk out of the car. There's not like, oh, well, let's this kind of checkout process and let me kind of, book the next appointment, this and that. All of that can be done kind of dynamically and through kind of all the information. And so again, hey, I noticed you really like to come in on, Tuesdays at 4 p.m. Then that's the time that will be offered to you. Again, we have all that information, but right now we don't quite utilize it or don't utilize it in a very systematic way. And so, even from, revenue cycle management, how do we take all the data that we have on insurances, insurance claim payments, denials, things like that, and then create, what I call like a self-healing kind of database, because we're constantly getting information. So how do we continue to fix that says, you know what, I have entered incorrectly that this thing should be paid at $100. The insurance keeps paying me, it could be $101 or $99. But oftentimes, organizations aren't fixing that, or they're fixing it in a very manual way. And so how do you kind of create the systems that will allow it to kind of make these corrections with a certain set of rules, so that the business runs, more and more smoothly. So I think that's, I'm looking forward to that part.
Yeah, I mean, it sounds like everything really just in service of trying to make for a much more seamless patient experience and thinking about just every single day, what's that 1% thing that we could be doing better to
Yes.
almost catch up dental to a lot of industries that I think have done a great job of really thinking about the customer experience.
Right. And that's where we look for a lot of examples that aren't necessarily, hey, let's look for, whatever, a healthcare example. I think, we look broadly in terms of like, hey, what do people like? And it's not necessarily enhancing, kind of continue on that Uber example, right? The Uber example is, I know what's going to cost, and then I just step out of the car. But if I were the taxi cab company, I'd say, okay, well, instead of paying cash, I'm going to have a credit card terminal, and then, make it easier for you because you can pay with a credit card terminal in the cab. But that's not necessarily like, they're kind of stuck in their kind of, mindset, right? Like their frame or the map of the world, as opposed to, no, what, I would love a world where, hey, everybody just walks out of the practice. There is no checkout process needed. You know what's going to cost, you come in for it, and you walk out. And everything kind of gets auto billed. I don't have to take out my card. I don't need to do Apple Pay. Like all of these things are great, but it'd be even greater if, I'm valuing the patient's time and kind of providing that experience where, that they're becoming more and more accustomed to.
Yeah, there's I think Brian Chesky had I don't know if it was a podcast or a talk, but kind of went through the exercise of saying, what's a 5-star experience?
Yeah, the 11-star.
And it's just like, what's a 13-star experience, right? But
Yeah.
it really forces you to get out of your world and think about stuff much more outside of the day-to-day and think, if we had to draw this from scratch, and you end up thinking about such more innovative ideas.
Yeah, absolutely.
Phil, I'm taking a lot of time here. I know we're at the 30-minute mark. But what is a final parting word here on, around technology, the challenge of implementing technology to scale and grow, both an employer brand, but also your organization?
So I would say my final thought is really, I always say, look, I'm not smart enough to figure out what's the technology that's going to win out and be dominant. But what I want, for the organization is for us to, be open-minded and flexible. And so our skill is not necessarily how to use a particular kind of software really well, as opposed to, hey, we're going to, kind of be open to adopting new technologies all the time. whatever, kind of always looking over the horizon and being kind of curious, intellectually curious on how things can kind of help us continue to advance the patient experience. And so, yeah, so it's just not stuck with, hey, this is, I implemented this and this will how it will always kind of be forever and ever. And I feel like that's like a common mentality within dental. And I think, look, we're fortunate to be in a time where I feel like there's this kind of dental technology renaissance where there's so many kind of smart and ambitious people thinking through kind of problems and how to apply technology to solve those problems. Um, some will be successful, some won't. And I think from our perspective, it's like, okay, company A is fantastic today, but didn't kind of keep up with the times, and now company B is better. I want us to be good at, okay, well, we'll just switch to company B. Maybe again, like the integrations, there's the change management that we have to manage for. But if company B is actually doing it better, then we should focus on, leveraging the best tools that are available, to us in the marketplace for us to deliver a better patient experience.
I'm certain that you built an organization of adaptation, and dealing with those changes and having lots of people who are ready to make changes and build something not just great at the organizational level, but at the practice level for each patient.
Yeah.
Phil, thank you so much for the time today.
Thank you for having me.
We will certainly be in touch. I know we will. But thank you for joining the show.
All right. Thank you.
Thanks, Phil.